Adventures in Colorectal Cancer, 2026, August 21st. Where to start with this one? The TESSAR study in England, done in 2016 with 302 patients randomly randomized. So some got complete, their pelvic cavity eviscerated, and some got chemoradiation. It's what they call a non-inferior study, meaning that they expect the chemoradiation and the people having their pelvic cavities eviscerated would have the same outcomes, life expectancies, and at a minimum, the same quality of life. So I've read the outline. I haven't found the results of it. So I really don't know if it was good, bad, or indifferent. All I know is that there was a study done in 2016. Next time I see a doctor, I'll ask him about it. So, although, like I suspected, although it's relatively new in BC, it's at least a 10-year-old option in England. I get my positioning MRI next Wednesday, and then my visit with the medical oncologist, the chemo guy, has been moved up to the 18th of September. It's just this weird legging out thing. Part of what I have to do for the positioning MRI and for radiation is 1 hour before the procedure, drink 500 milliliters of water. They want the bladder full so that there's less damage done to it. And probably because it moves the rectum around, because it's all down in that area. Most of you know that I'm a drunk. I've been clean and sober for 36 years now, slightly over 36 years. One of the things that made me a really, really fucking good drunk was that I start drinking and I start peeing. My liver and kidneys just like take over and clear it out. So I could have, I can't drink. I can only drink half a beer without having to get up and go to the bathroom. And I would get chided for this all the time. Coffee, same thing. It makes me pee. Like if I'm going on a long road trip, I can't have coffee to start. Or like you're going to be pulling over every half an hour for the first couple hours so I can pee. Especially in a car, that's that fine vibration or something that really gets to my bladder. And yeah. So now I'm going to practice. Yeah. So I'm practicing. I'm actually drinking 750 milliliters of water and seeing how long I can hold it. Hopefully, meaning that with proper timing, if I know exactly when the MRI or radiation is going to happen, I can time it to be 1 hour before that and then hold it for it, because it's going to be 2 hours. So it's an hour before, and then the procedure is itself 20 minutes. And there's all of the futzing around that they're going to be doing before that, and the waiting because this person or that person. So figure if I do 750 and then get used to holding that for 2 hours, then I've got a good shot of not pissing my pants. We're trying to hold 500 for 2 hours. Another OBW. So this thing is absolutely full of OBWs. Fortunately, the person that I'm in touch with had warned me about this. So I've been practicing. The problem is, let's say I drink twice a day. I do this the 750 milliliters for as long as I can hold it. Believe it or not, that's really dehydrating because your pee always takes up body salts, and I don't have that much salt intake to begin with, which is one of the reasons I don't have big heart problems. So I don't really have a lot of salt intake, or I pay attention to my electrolyte intake. So yesterday I tried it, and so that's what, 1.5 liters of water, once at like noon and then once at 5 o'clock. By 8 o'clock, man, I had a headache. My mouth, the back of my throat was dry. I'm feeling lethargic, and I'm going, what on earth? And then it dawns on me, holy crap, I'm dehydrated. I'm full of water, but I'm dehydrated because I keep peeing out all my body salts, because my body just wants to get rid of the water. And when it does that, it gets rid of what's ever there. So yeah, so now I got to pay attention to making sure that I keep up my electrolytes. I have a friend who has just had surgery for women's cancer reproduction, women's reproductive cancer. I touched base with her. When I had a broken leg, like the first week, everyone was, oh, yeah, how you doing? How you doing? Second week was less, and by like the third week, it was like, yeah, whatever. So after 6 months, you're pretty alone. And because her recovery was going to take months, I made sure I stayed in touch with her. And I've been pretty much bitching at her about, I go to, none of the doctors will talk outside of their specialty about what to expect between, let's say, having my rectum surgically removed as opposed to having chemo radiation therapy on my rectum. And it's this whole professional ethics, not stepping on someone else's specialty, which generally I agree with, but in this case, it's like I would like to know everything to make a decision, because what I feel like is I keep getting blindsided. Like, yeah, okay, well, go try this, and then this guy sits, well, it's almost the same as this, and you're going to have these extra side effects. Maybe not. Who knows? And I feel like I'm being asked to make a choice without all of the relevant information, even though it would mean nothing to me. I don't have the knowledge or experience to actually make an informed decision on this, but I'm being asked to. And every step of the way, it's another new piece of information. Yes, I could go do internet searches, but I'm not sure, how, that's a big rabbit hole, and it could be very, very dangerous. And so this person, like I've been saying this, and they've been pushing back, or obviously she's been pushing back, going like, yeah, stop it. Like, it's not very productive. And I finally figured it out. And it's this issue, like, it's a crapshoot. I'm being faced with a crapshoot over which treatment will work and give me the best quality of life. And until I actually do it, I won't know. I won't know for like a year, 2 years. And boy, that's really disconcerting. It screws with my head. I'm as well as I'm autistic. So being autistic, new things are pretty scary. And like, what do you mean I got to do this now? What do you mean you got to do this now? So yeah, so fortunately, in our conversations back and forth, like I have no doubt in my mind, technically, the physicians involved in this are highly skilled. It's like, you know, um, what can I say? I'm a design engineer. I'm a really, really good optomechanical design engineer. I can design, you tell me, you give me a specification, I can design you something. I can tell its performance. I can tell you whether it's going to meet or exceed the performance. Well, it's the skill. It's the skill in design. Engineering, design engineering isn't about the design, because that comes with repetition and knowledge and being better at, finding out how other people did it. And that's the skill part of it. The professional part of it is the other stuff, like how do you figure out, like, what is this? What is that? How is it? And that's where I feel this is lacking. Yeah, I kind of expected the BC medical system to be fragmented. It's just the bureaucracy is just that way. But but it's just this whole thing of, well, this is what this does. What do you think? Would you like that treatment? It's just like, what the fuck do I know? I'm just a guy who woke up one morning with a bloody polyp in my rectum that got removed. And now I'm being, what was that? That was April 8th. So 4 months later, I'm being asked to make major life-changing decisions based on what I think is best for me. Just, oh man. Yeah, I can actually feel the stress, even just talking that way. But yeah, anyway. So yeah, next Wednesday, I get the positioning MRI. And hopefully I won't pee my pants halfway through this thing. Although I'm sure I'm not the first person to do that. I should bring a change of clothes. I'll bring a change of clothes. Making inappropriate life decisions. You don't make any money, but boy, you get good stories.